tell me full form of ESR. Okay, very good. What's your name? Varshi. Okay. Varshi. Oh, Varsha. Okay. Tell me, why do we do this test, ESR? What is that? Is by name it suggests that. What is its use? Come in, come in. Okay. So, in which condition it is used? Come in. Pregnancy. So, to diagnose pregnancy, you will do ESR. Then, you are right that in pregnancy ESR is raised. But for diagnosis of ESR, will you do ESR? Sorry, for diagnosis of pregnancy, will you do the ESR? No, definitely not. Okay. What's your name? Sneha Kole. Okay. Yes, come in. Tell me the utility of ESR. Tell a bit loudly. Non-specific. Okay, fine. It is raised in many disease conditions. So, what is its utility? Come in, come in. Still, today we are getting from the clinician that ESR is must for this patient. Though there are many different kinds of sensitive tests for diagnosis of any disease, we still get a request from the clinician for the ESR. So, what is its utility? You don't know or don't know? Was this taught in previous class? You was present in the previous class? Okay. What's your name? Urmimala. Okay. You tell me the utility of ESR. Oh, you was not. Okay. What's your name? Tanishta. You tell me what is the utility of ESR? You know what is ESR? You was present in the previous class? Okay, full form?
Erythrocyte Sedimentation.
Okay, very good. What is its utility? Anyone in this class can answer this question? Anyone? Utility of ESR? Severity of inflammation. Like what? Can you explain it by examples? Means you are telling that a person is having pneumonia. To assess the severity of pneumonia, will you do ESR?
So when the normal blood flow is there is a laminar blood flow, and if it is either turbulent, then we can do ESR to know whether if the blood flow is compromised or the nature.
No. Absolutely wrong. Yes? Yes, very good. Prognosis. Prognostic, it has got some prognostic importance. What does it mean? Explain.
Whether the patient is improving or not.
Yes, very good. Yes. Suppose we are having a patient. He has been diagnosed for XYZ disease. Now, the clinician is giving him the therapy. Whether it's an antibiotic or some other therapy, he is giving him the therapy. Whether the patient is improving or not, ESR can tell you. Okay. So, this is the utility of ESR. The other utility of ESR is if there is some occult disease, patient is complaining of some non-specific symptoms, and you are suppose suspecting any particular entity, any particular disease, and you are going for the test, you are doing a particular test for that disease and you are getting negative results. This many times occurs in the clinical practice. So in that case, how will you know that whether the patient is actually diseased or not? Are you getting my point? Patient is complaining non-specific symptoms. This could be sometimes psychological. Okay. So to know whether it is actually pathological or psychological, you can take help of ESR. If the ESR is raised, that means patient is really diseased. Maybe I am not able to diagnose him properly. I have to work up properly for this patient, but patient is diseased. Okay? Is it clear now? So let's come to the today's topic. Actually, this was also part of the previous topic. So this is a microscope. Here two microscopes already present, and the labeling is there. Okay. So what kind of microscope this is? Yes? Light field microscope. Any other specifications? Compound microscope. Very good. It's a compound microscope. Why it is compound microscope? Why it is called compound? Not simple. At least two lenses is used. One is objective, one is eyepiece. Two lenses is used. So that's why it's a compound. In simple microscope, only one magnifying lens is there. Any other specification can you tell? Yes? Yes, very good. It's a binocular. We also have seen the monocular, which is still used in some of the labs, but most of the labs prefer the binocular. So these are just few basic specifications. Now coming to the parts. So what is this? Base. Very good. And what is this? This thing? Light source. This is the source of light. Here there is a LED bulb. Okay. What is this? Say in the picture and tell me. What is this? Yes? Condenser. Actually the diaphragm is present within it. Okay, and there is also iris present. Okay. Here is a system for increasing or decreasing the size of that iris. Okay. If I takes it here, then there will the iris, yes, come. The iris size will decrease. Okay. So the diaphragm is present inside the condenser. Okay. Now, what are these called? Yes, objective. Here in this microscope, there are four objectives. Yes, four objectives. One which is present here, this is 4x. That means it can magnify any object up to 4 times. This is also called as scanner. Okay, it is used for scanning a slide. The next objective is 10x. It can magnify up to 10 times. Okay. The another one is 40x. It is the 10x is called as low power. Okay. Nothing to write. You can just understand the concept. Then another objective is 40x. It is also called as high power. And the last one is 100x. And it is another name for the 100x, oil immersion. Why oil immersion it is called? To observe any object through this lens, you need cedar oil. Okay. So this is the objective. This is called as nose piece. Written there. Oh. Written there, no? Nose piece. Yes. This is called as nose piece. Okay. And these are the eyepiece. And this part is called as this part. Arm, body, frame, there are many names. Okay. And what is this? Coarse adjustment, and this one? Fine adjustment. Very good. There are also many other things like this. What is this? What is this? Stage control. Yes, this is used to move the slide to and forth. Okay, so I think this is the stage. Okay, this is the stage. So I think you all know what are the parts of a microscope. Okay, do all of you know how to focus? Okay, you have learned this in the physiology. Okay, fine. So I am not going into details of that. Now coming to today's topic, which is neutrophilia. Now tell me, how many of you have done the peripheral blood smear and stained the slide? How many of you? Just raise your hands. Just few of you? Everyone? Then why they are not raising their hands? Okay, 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 fine. How many types of cells do you observe under a microscope after staining? Okay, from can you tell me? Have you? Yes, stand up. You tell me that did you perform the peripheral blood smear and stained the slide? Okay, fine. What are the cells you have observed under the microscope? RBCs. Okay, fine. And any other cell apart from RBC? WBCs you have observed. Okay. What are the different WBCs you have observed? Eosinophil, neutrophil. Okay. Okay. You have seen monocytes too. Okay. Any other cell? Basophil. You have seen that? No, you have seen that basophil. Okay. So that means you can identify the basophil. Okay. Any other cell? Lymphocyte you have not seen? Okay, you have also seen the lymphocyte. Okay. Sit down. You stand up. Yes. Yes. Have you done the peripheral blood smear? You have also seen all the cells? Okay. Tell me the features of a neutrophil. Yes. How will you identify a neutrophil? Bilobed. Wrong. Sit down. You stand up. You tell me, how will you identify a neutrophil? First tell me the size of a cell. Neutrophil size. First of all comes the size. Without that, even RBC can get the nucleus. That nucleus could be bilobed. So you can, by mistake you will call it a neutrophil or any other cell. So first of all comes the size. Round, okay. Size is round, that is a shape. Round is the shape. What is the size of a neutrophil? By which cell will you compare in a peripheral blood smear? Okay, very good. You will compare it with an RBC. Fine. So, what is the size of an ideal neutrophil? You know or you don't know? Okay, sit down. You tell me. Size of a neutrophil. Means same size to a RBC, double size to an RBC, 3 times to an RBC. What is its size? You don't know? Okay, sit down. You please tell me. 10 to 12 micron. Where did you read this? Physio. It was 10 to 12. Okay, larger than RBC is fine, but what is how many times? I told you 2 times, 3 times, 2.5. Okay, fine. Correct. 2 times. Approximately it is 2 times the RBC. Sit down. Normally it size is 12 to 15 micron. And what is the size of an RBC? Size of an RBC, anyone? 7 micron. So it comes out to be approximately 2 times. Okay. Can you please, yes, hello, you, yes, stand up. You tell me, have you done the peripheral blood smear of your own? Okay. Now tell me the other features of a neutrophil. One is the size, shape. This has been covered. It will be round in shape. It will be 2 times the size of an RBC. Any other feature? What about the cytoplasm? Granulated or agranulated? Granulated. Okay. What kind of granules? Fine or coarse in the neutrophil? Yes? Coarse. Fine or coarse? Choose out of these two. No, wrong. Fine granules. Then what about the nucleus? Multinucleated. What you told? No, wrong. Sit down. You tell me. Till now, the shape, size, cytoplasm, granules has been covered. Now tell me about the nucleus. You know or you don't know? Have no idea. Okay, sit down. Please stand up. Yes, you. Yes, you. Tell me, yes, I am talking about you. Yes. Tell me about the nucleus of a neutrophil. Multi-lobed. Okay. How many lobes? Multi means it could be 2, 3, 4, 5, 6. How many? 2, 2? No. Actually, it is not 2 lobes. Minimum 3 lobes should be there. Minimum 3 lobes, not 5. Minimum 3 lobes, 4, sit down. 4 lobes is acceptable. Up to 5 lobes, it could be present. Yes?
Then we can say the age of a neutrophil, because we can use Arnold count to find the age of neutrophils. There
Yes.
are 1 to 6 lobes and 3 to 4 are called mature lobes.
Yes, very good.
Mostly 3 to 4 lobes.
3
are
to
found
4
in
lobes.
neutrophils.
When comes the 5 lobe, you have to see the percentage. Okay. For hyperlobation, you have to see percentage. If there are more than 5% of neutrophils are having more than, having 5 lobes, more than 5% of neutrophils having 5 lobes, then you will say hypersegmented neutrophils. Okay. Or if just single neutrophil present having more than 5 lobes, means 6 or 7 or 8 lobes, you can say hypersegmented neutrophil. Okay. So this is clear up to now? Okay. So this is the neutrophil. I will demonstrate you in the slide also. So I think this is clear now. Is it clear? These are the RBCs and this is a neutrophil. Clear? Any doubt? Now, this is the normal count in an adult person. What is the normal count? 2000 to 7000. Okay? And in case of percentage, 40 to 80%. That is the normal range. Okay? What about if this increases from 7000? What we will call the term? Neutrophilia. Okay. So when the absolute count is more than 7500, we call it as neutrophilia or neutrophilic leukocytosis. Okay. What is the total WBC count normal range? Yes? How much? 4 to 10,000. 4,000 to 10,000. That is the total WBC count. Now, causes of neutrophilia. There are many different causes. Remember, any kind of acute inflammation. I think inflammation has been covered in the general pathology classes. So, in case of any kind of acute inflammation or any inflammation, the itis term is used. You have noticed that any organ, any kind of infection, if it gets involved in an organ, we use itis, like meningitis if it is in the meninges, like there are many other terms. Actually, pneumonia we tell, actual name should be pneumonitis. Okay, but since we have used for many years this pneumonia, so we don't change this term. Okay, so any kind of acute inflammation can lead to neutrophilia. Okay, presence of any kind of tissue necrosis like myocardial infarction. Okay, why does this myocardial infarction occurs? Anyone have any idea regarding myocardial infarction? Very simple thing. Yes, tell loudly. Less amount of blood reaching to heart. Okay, due to any arterial blockage. So that will lead to tissue ischemia followed by necrosis, that is called as myocardial infarction. So there is tissue necrosis is there. Tissue necrosis can lead to neutrophilia. Burn injury, you all know, burn can lead to death of the cells and necrosis. Other cause is acute blood loss or acute hemorrhage. These are very close terms. Okay, any kind of acute hemorrhage, like when acute hemorrhage could happen, like any other examples, in which condition a patient could have acute blood loss or acute hemorrhage. Road traffic accident, patient suffered a severe road traffic accident, so that can lead to neutrophilia. Now the another one is some myeloproliferative disorders like CML, CNL. These kind of disorders can lead to neutrophilia. Okay, some metabolic disorders like uremia, acidosis, gout can also lead to neutrophilia. Can anyone explain this uremia? What is uremia? Yes? Tell loudly. Blood in urine? No, not at all. Blood in urine is hematuria. Excess? Yes. Excess urea in the blood. Uremia. And what is acidosis?
pH of the blood is less than 7.35 and
Yes.
accumulation of H+.
Yes, very good. So acidosis means pH is below the physiological limit. And what is gout? Increased uric acid. Okay. So all these conditions can cause neutrophilia. There are some physiological conditions also. Patient is not diseased, but his blood is showing neutrophilia, like exercise. In case of females, pregnancy, some kind of emotional stress can also lead to neutrophilia. So I think you will utter these, at least 2 or 3 of these terms in the exam. Okay. Now there are some abnormal leukocytes, abnormal forms of leukocytes present in the blood. Okay, one of the abnormal thing which is present in the neutrophil I am talking about is toxic granules. Okay, what is toxic granules? Anybody can tell me? Do you have any idea regarding toxic granules? Nobody? Okay, what is the what kind of granule a neutrophil contains? Fine granules. If it becomes coarse, that is called as toxic granules. Why it occurs? Because of some infection. If a person is having severe infection, that can lead to toxic granulations. Okay. Dole inclusion bodies. Okay. This is also the result of infection. Some cytoplasmic vacuoles. This could be found in the neutrophils. And left shift. What is left shift? What is left shift? Any idea? By terminology, what are you guessing? Any guesses? What shape changes to? Actually, in case of severe infection, the immature forms of neutrophils like metamyelocytes, band forms, those come into the circulation, okay, to help the patient, to counter the infection, okay. So that leads to increased number of these immature neutrophils, okay. This is called as left shift. So I am going one by one. This is the toxic granules. Can you see? There is a neutrophil and the granulations are coarse. Can anyone tell me why this is not an eosinophil? Because eosinophil also contains coarse granules. So how will you differentiate it from an eosinophil? Anyone? Okay, very good. One differentiating point is the multi-lobation. And in case of eosinophil, how many lobes will be there? Two, only two. And in a neutrophil, there will never be two lobes. Not never, most of the time. There are some conditions in which you can get two lobes. And any other point regarding this granules?
Color.
Yes, very good. Color. This will generally give purple color granules. And in case of eosinophil? No, not pink. Brick red colored granules. Okay. This is Dole inclusion bodies. This is light pink colored inclusion. Okay. Found in many infections. Now, this is abnormal granules. This is not toxic granules. This is found in Chediak-Higashi syndrome. Okay. Next one, this cytoplasmic vacuoles. Actually, this vacuole could be present in case of severe infection, or it could be present because of storage artifact. Do you know storage artifact? What do you understand by storage artifact? Okay. Storage artifact is that suppose a patient has been, the blood has been drawn from the patient body, okay, and the blood was kept for more than 24 hours, let's say at 4 degrees centigrade or at room temperature for more than 6 hours. In that case, the neutrophils, and not only neutrophils, many other cells starts getting degenerated, okay. So because of this, some artifact develops in them. One of them artifact is appearance of vacuoles, okay, clear? This is the left shift, this is a band form, this is a metamyelocyte, okay, this is again a band form. So this is called as left shift, okay, and also the toxic granules is also present. Now there are some also other neutrophils, hypersegmented neutrophils. I just now told you what is, when will you call hypersegmented neutrophil. Can anyone again repeat this?
And more than 5% of the neutrophils have more 5 or more than 5
5 lobes. If there is 5, there are 5 lobes, more than 5% of the neutrophil should contain that. And if there is more than 5 lobes, Only one neutrophil is enough. Okay. What is this? Pelger-Huet cells. This is actually an autosomal dominant condition in which since birth the patient develops bilobed neutrophils. The neutrophil doesn't mature more than 2 lobes. It still remains bilobed. Okay. That is called as Pelger-Huet cells. But in case of some disease condition, some of the neutrophils show bilobation. Okay, that is due to some disease condition like myelodysplastic syndrome. We can see this Pelger-Huet like cells. This is called as pseudo Pelger-Huet cells. Okay, in this you will not see all neutrophils to be bilobed. You will see some of the neutrophils to be bilobed. Some are normal lobated. Is it clear? What did you understand by this? Pelger-Huet cells.
Sir, in this case, nucleus segmentation is failed.
Okay,
So
very good.
The nucleus is unsegmented rod-like or maybe
Not unsegmented, it is bilobed. Okay, only 2 lobes are present, and this is an autosomal dominant condition. Okay. Now, what is pseudo Pelger-Huet cells? Just now I told you. Can you explain? Bilobe structure means bilobe neutrophils. Okay. Tell loudly. Failed to segment. Okay. So this is an autosomal dominant condition. This is clear. It is clear to all. What is this? Pseudo Pelger-Huet cells. What is pseudo Pelger-Huet cells? My question is that. You didn't understood that. Because of some disease condition, most commonly myelodysplastic syndrome, there is hypolobation in the neutrophils. Okay, so some of the neutrophil will show bilobation. Okay, is it clear now? In this, there was some genetic defect which was present since birth. In this, the patient was normal. He was showing normal kind of neutrophils, but later on he developed a disease, and because of this disease he is carrying some of the neutrophils which are bilobed. Okay, so this is called as pseudo Pelger-Huet cells. Is it clear now? What are the disease condition? Most commonly myelodysplastic syndrome. Apart from that, some leukemia can also show Pelger-Huet cells. Is it clear now? This is the hypersegmented neutrophils. Can you see how many lobes are there? How many lobes? More than 5, I think. 1, 2, 3, 4, 5, 6. If we count this, it could get 7. So it's an hypersegmented neutrophil. These are the hyposegmented neutrophils. Only 2 lobes are there. So now Pelger-Huet cell and pseudo Pelger-Huet cells clear to all? Can you explain now? Yes? Yes? Explain to me what is Pelger-Huet cells and what is pseudo Pelger-Huet cells. Autosomal dominant condition. পরবর্তীকালে না জন্ম থেকেই হ্যাঁ নিউট্রোফিলটা বাইলোবডই থাকবে, ওটা ট্রাইলোবড multi-lobed হবে না, bi-lobed ই থাকবে, ঠিক আছে? Okay, what is pseudopelvic red cells? বুঝতে পারোনি? এখনই তো এক্সপ্লেন করলাম। Did you understood what is pseudopelvic red cells? Yes, very good. Very good. So, how will you differentiate between these two? Just now I explained both these terms. In case of pseudopelvic red cells, the patient is developing because of disease, not since birth. Okay, is it clear? In case of pseudopelvic red cells, patient is developing due to disease like myelodysplastic syndrome, like leukemia or many other disease. Okay, and because of this disease, some of the neutrophils are having bilobed nuclei. Okay, but some of the neutrophils are also having trilobed, means normal segmentation. Okay, so by this, that some of the neutrophils are normal, some are hyposegmented, you can differentiate between pelvic red cells and pseudopelvic red cells. Is it clear now? Is it clear to all? Okay. Now, coming to the eosinophilia. Can you describe an eosinophil? Yes. Describe an eosinophil. No, starting from the shape and size. Very good. No, before the nucleus, explain about the cytoplasm, about the granules. Fine? No, not fine. What is the opposite of fine? Yes, it contains coarse granules. Color of the granules? No, wrong. Brick red colored granules. Now what about the nucleus? Bilobed nucleus. Okay, sit down. So I think all of you know, have understood the shape of an eosinophil. All of you will identify the eosinophil. Okay, so this is a eosinophil. Can you see the bilobations? The coarse granules, brick red colored. I will show you the original thing in the slide after a few moments. Okay, here is a neutrophil present. Now, what happened? So, eosinophilia. What are the conditions which can lead to eosinophilia? One is allergic conditions. Another one, parasitic infections. Okay. Some other conditions like myeloproliferative neoplasms, chronic myeloproliferative disorders, some lymphoma can also lead to eosinophilia. And skin diseases also like eczema, pemphigus, dermatitis herpetiformis, these can also lead to eosinophilia. And hypereosinophilic syndrome is actually an idiopathic syndrome, okay, in which patient is having idiopathically very high numbers of eosinophils in his peripheral blood. All the other tests are negative, all the other conditions are not present, then we call it an hypereosinophilic syndrome. Okay. Can anyone tell me about Loeffler syndrome? Any one of you have heard about this? No one? Tropical eosinophilia. These syndromes also lead to increased eosinophil level. So, is it clear now? In the examination, at least 2 or 3 you have to tell. So please remember 2 or 3 common reasons for eosinophilia. There are many reasons of eosinophilia. ওইদিকে eosinophil বোঝা যাচ্ছে তো? কি কালারে হবে? গ্র্যানুলেশন তো থাকবে না, কালারটা কি হবে? নো, নট পিঙ্ক কালার, হোয়াইট, ব্লু ঠিক আছে, বাট গ্রেইশ ব্লু, ঠিক আছে। ব্লু সাইটোপ্লাজম লিম্ফোসাইটের হয়, বাট এরটা গ্রেইশ ব্লু, ঠিক আছে। এরপর হচ্ছে এবার নিউক্লিয়াস। নিউক্লিয়াসটা কীরকম থাকবে? ইয়েস, okay, indented nucleus, maybe kidney shaped, maybe some other shape, indentation, okay. And chromatin character, clumped or fine thin lacy or open type chromatin কি রকম? ফাইন লেসি ক্রোমাটিন হবে, ঠিক আছে। এমনি সবথেকে শক্ত সেল হচ্ছে মনোসাইট। নিউট্রোফিল, ইওসিনোফিল মোটামুটি চেনা যায়, কিন্তু মনোসাইটটা একদম মানে খুব মানে শক্ত। বাকি লিম্ফোসাইট তো সহজ আছে। লিম্ফোসাইট কত রকম হয়? 2 রকম। কি কি? লার্জ অ্যান্ড স্মল, সাইজের তফাৎ আছে। আচ্ছা, এমনি জাস্ট জিজ্ঞেস করছি, আরবিসিটা ম্যাক্রোসাইটিক, নর্মোসাইটিক, মাইক্রোসাইটিক, 3টে শেপের হয়, কীরকমভাবে চিনবে? এনিওয়ান? না না, আমি বলছি যে আরবিসিটাকে বলা হয় না ম্যাক্রোসাইটিক আরবিসি, মাইক্রোসাইটিক আরবিসি, নর্মোসাইটিক আরবিসি। কার নিউক্লিয়াস দেখে? কার নিউক্লিয়াস? আরবিসিতে তো নিউক্লিয়াসই হয় না। সাইজ মানে নর্মাল সাইজটা কি? 7 মাইক্রন। তো ওখানে তো কোনো মানে স্কেলটা রাখা নেই যে 7 মাইক্রন এইটাই, তাই না? এটা তো একটা আন্দাজ করতে হবে। তাহলে রেফারেন্সটা কি নেবে? শেপ, কোন একটা রেফারেন্স আমাকে নিতে হবে তো। না, নিউট্রোফিল থেকে রেফারেন্স নিলে হবে না, একটা রেফারেন্স নিতে হবে যেটা আরবিসির মতো সাইজের, 7 মাইক্রন সাইজের একটা জিনিসটাকে নিতে হবে, বা 7 to 8 মাইক্রনস। নিউক্লিয়াস অফ এ লিম্ফোসাইট, ঠিক আছে, নিউক্লিয়াস অফ এন স্মল লিম্ফোসাইট, দ্যাট ইজ আওয়ার রেফারেন্স, ওর সাথে কম্পেয়ার করতে হবে, ঠিক আছে। এবার বলো, নর্মোসাইটিক হয়, নর্মোক্রমিক বলা হয়। এবার হাইপোক্রমিক কখন বলবে? এমনি এইগুলো কিন্তু পরে আবার ক্লাসগুলো হবে, জাস্ট ফাঁকা আছে বলে বলে জিজ্ঞেস করছি। হাইপোক্রমিক বলা হয় তো, মানে আরবিসিতে হেমোগ্লোবিন কনসেন্ট্রেশন অনেক কম আছে, বিশেষ করে আয়রন ডেফিসিয়েন্সি অ্যানিমিয়াতে এটাই হয়, মাইক্রোসাইটিক হাইপোক্রমিক অ্যানিমিয়া বলা হয়। তো মাইক্রোসাইটিক বোঝা গেছে, একটা স্মল লিম্ফোসাইটের নিউক্লিয়াসের সাইজ থেকে ছোট হবে, তাহলে বুঝে যাবে। এবার হাইপোক্রমিক কি করে বুঝবে? কেউ একজন বলো, জানা আছে কি? জানা নেই? জানা নেই। একটা নর্মাল আরবিসিতে সেন্ট্রাল প্যালার হয়, সেটা দেখেছো? এখানে যারা শোনো, যারা দেখছো একবার আরবিসি দিকে দেখো, সেন্ট্রাল প্যালার কি বুঝতে পারছো? আরবিসি গুলোকে দেখো, মানে আরবিসিতে যেটা শেপটা মোটামুটি রাউন্ড টু ওভাল শেপ, মাঝখানে জায়গাটাতে প্যালার আছে, মানে ওই জায়গাতে মনে হচ্ছে যে ফাঁকা, ঠিক আছে, মনে হচ্ছে, অ্যাকচুয়ালি ফাঁকা নয়, তো ওটাকে বলা হয় সেন্ট্রাল প্যালার, ঠিক আছে। দ্যাট শুড বি উইদিন 1/3 অফ দ্য ডায়ামিটার, যেটা টোটাল ডায়ামিটার তার 1/3 হতে হবে, ঠিক আছে, দ্যাট ইজ নর্মাল, বা তার থেকে কম। If it is more than 1/3, then it is hypochromic, ঠিক আছে, বুঝতে পেরেছো? আর যদি ওটা সেন্ট্রাল প্যালারটা না থাকে তখন কি বলবো? হাইপারক্রোম্যাটিক বলা হয় না, টার্মটা ইউজ করাই হয় না। মানে একটা আরবিসি আমি দেখতে পাচ্ছি যেটা পুরোপুরি একরকম সমান ডেনসিটি আছে, মানে ধরো যদি আমি পিঙ্ক কালারটা বলছি, যে রকম পিঙ্ক কালার পেরিফেরিতে সেরকম সেন্টারেই আছে, মানে পুরো এক সমান কালারটা, তখন কি বলবো? হাইপারক্রোমিক বলা হয় না, স্ফেরোসাইটসে থাকে।